Hello, everyone. I am Omid Sanaei, a postdoctoral research fellow at the Johns Hopkins Hospital Division of Gastroenterology and Hepatology. On behalf of Dr. Moen Kashab, the leader of this study, and all of our co-authors, I have the pleasure to present our paper, which has recently been published in Endoscopy. The title of this study is Impact of Prior Treatment on the Feasibility and Outcomes of Zenker's Peroral Endoscopic Myotomy, or ZPOM. Zenker's diverticulum is a herniation of mucosa and submucosa through a pharyngeal weak point between the lower inferior constrictor muscle and the cricopharyngeal muscle. The treatment is dissection of cricopharyngeal muscle either by open surgery, rigid, or flexible endoscopy. ZPOM is one of the endoscopic techniques which uses the principles of submucosal endoscopy to allow full exposure and division of the cricopharyngeal muscle. Initial studies have reported promising outcomes for ZPOM. In this study, we aimed to assess the feasibility, efficacy, and safety of ZPOM as a rescue technique in the management of Zenker's diverticulum after prior failed interventions. This is an international multi-center retrospective study in which a total of 32 patients were included from 7 centers. The primary outcome of this study was clinical success defined as a complete or near complete resolution of dysphagia without the need for repeat endoscopic or surgical intervention during follow-up. The secondary outcomes were technical success, procedure duration, length of hospital stay, adverse events, and symptom recurrence. The overall technical success rate was 93.8%. Having excluded the 2 technical failures, clinical success was achieved in 96.7% of the remaining patients. No symptom recurrence was observed during the median duration of follow-up of 166 days. 4 patients had adverse events, 2 inadvertent mucosotomies, and 2 leaks found on post-procedural esophagograms. Given the retrospective nature of this study, the duration of follow-up was variable. Therefore, the next step would be prospective studies with longer follow-up duration to investigate the long-term performance of ZPOM. In conclusion, endoscopic management of Zenker's diverticulum using the ZPOM technique may be offered as a feasible, safe, and effective alternative for the majority of patients with recurrent symptoms after prior surgical or endoscopic intervention. Thank you very much for your attention.